Hi, good morning and welcome. I'm Ryan Green. This is Karl Steinlage with Steinlage Insurance Agency, and we're happy to have you join us for our annual Medicare informational session. Believe it or not, we were talking before we got started here, and this is already our fourth annual session. So hopefully we've got some new information to share, as things do tend to change in Medicare quite readily. But at the very least, we'll be sure to cover the most important information for you to help make you in a position to make better decisions when it comes to selecting your own Medicare package. For those of you that have joined us in prior years, you may notice that we've changed up the format a little bit this year by adding a video component to allow you to put a face to the voices that you hear. Now, whether or not you consider that to be a good thing, we'll leave up to you. But the goal for today is to help provide you with information to help make you more knowledgeable and a better consumer of Medicare. Each year during open enrollment, you're responsible for selecting a Medicare package. Which one is the right one depends heavily on a number of different factors. Get it right, and you'll wind up with a healthcare solution that meets your needs in a cost-effective way. Get it wrong, and you might wind up with a very expensive headache. That's where Karl can truly add value in that situation. He can leverage his expertise and experience in the Medicare system to match individuals to a Medicare package that meets their needs in the most cost-effective way possible. Over the years, he's done a terrific job and been of great service to our clients by either helping them reduce their premiums, enhance their coverage, or in some cases, he's been able to do both of those things. Now, before we get started, we should point out that you will have the opportunity to ask questions. As we move along, just click the Q&A icon that you should see on your screen, type the questions in, and we'll circle back and address those towards the end of the session. I should also point out that Karl's contact information has been provided. You should see it in the presentation, and I believe it will also be sent in the follow-up that follows this. So if you have any more in-depth questions, or if you'd like to set up a time to sit down with Karl and talk about your own specific situation, you'll be able to do that. So without further delay, I'd like to go ahead and introduce Karl Steinlage with Steinlage Insurance Agency.
Hello again, thanks for having me.
My
It's a
pleasure.
little different being behind the camera rather
It
than
is,
just
it is.
on the audio, so we'll give it a shot here. And I think minimizing and avoiding headaches that should be on my business card as my primary goal. So that's certainly a great way to kind of frame this. Is Medicare in general is just a fantastic benefit. It's widely accepted. The grand scheme of things, it's pretty affordable. I know that might be a debatable topic, but yeah. But overall, Medicare is just fantastic. And because of that base being so rich, all these add-on plans that supplement Medicare, that replace Medicare through the Medicare Advantage program, there's just really a lot of confusion that kind of comes along with it. And our goal as an agency is to try to help educate you as much as possible or as much as you need, and then kind of hang in there from year to year to make sure you're not missing anything, tweak it left and right, or if you have a major change in your life, a move, a health scare or something like that, then move it a little bit further to adjust accordingly. So perfect segue into this thing. So a lot of what I do with advisor teams and with brand is, coming in and helping people figure out the entry into Medicare, which has some pitfalls and some potential snags. So if anybody listening is close to Medicare age, either turning 65 soon, or maybe they're on employer coverage and thinking of retiring fully and moving into Medicare, that's absolutely something I could help them with as well, is walking them through that whole process and rolling them into Medicare Part B properly. We have all the documents on our website. I've done it 500 plus times, so it's pretty simple for me to get you everything you need and kind of start that process as well. So.
It's funny to hear you say it's simple, because I think that's the exact opposite of what a lot of people think about when it comes to Medicare. I know this because I recently went through this conversation with my own parents. My mom was a teacher that retired after years and has pretty good coverage through the healthcare system afforded through the education program, but my dad does not. So they had just been doing the same thing every single year. And I asked her, well, why do you keep doing the same thing every year? And she said, well, all of this mail gets deposited into our mailbox every single fall, and the choices are so overwhelming that we'd rather just not do anything because we just can't understand it and it's too confusing. So I actually connected them to Karl here, and he was able to help them find a little bit of a better solution. So
I have a sneaky suspicion, a conspiracy theory, that the Medicare system exists to subsidize the post office and keep the post office in business.
That's probably the only reason the post office is still in business.
Direct mail is the main medium that these insurance companies use. So here's a slide of kind of the most common people of who I can help. Again, someone turning 65, getting into Medicare for the first time, somebody who's on Medicare but maybe has one of these fewer and fewer available retiree plans. So if you work for companies like Marriott's or Boeing or the federal government, you may be one of the very select few that has a retiree plan. What we're seeing is more and more often retiree plans are going up at a faster percentage, or terminating retiree groups altogether and then pushing you into the private world. So that's something that I can assist as well. Or if you're already on Medicare and just wonder if there's a better mousetrap, so to speak, that's a very easy analysis for me to help you with. Taking all of your current information, running an analysis of what you have, how much you're paying, and then going and shopping all the different various plans and giving you as close of an apples to apples comparison and trying to save money or improve your coverage. So our agency is actually, my grandfather started our agency back in the 50s. My dad took it over in the 70s, and about 2 weeks ago, I got the promotion into the corner office. So we have completely revamped our office, and I now have a window to look at. So, we've been doing Medicare for forever. That's really been our bread and butter. We don't do much other types of insurance like home and auto. We really focus on Medicare and the surrounding space. We also don't charge any fees to clients, which is always a welcome answer to a question of, well, how much do I owe you for this? And the answer is nothing, because we get compensated by whichever insurance company you pick. And the unique thing about health insurance is that our fees are already built into the plan. So even if you didn't use an independent broker, you would actually be paying the exact same price for AARP or Humana or whoever you may pick, because that commission is just built into the program. So our costs actually, or our services, are provided at no cost to you. Another question we get a lot is, even though you're in Missouri, are you licensed in other states? And the answer is yes. To date, we're licensed in probably 15 to 20 states. This slide is a little outdated because as clients call us and the opportunity to help them presents itself, it's very easy for us to get licensed in other states. So if anybody's listening in a blue shaded state that maybe we're not in right now, and you think you'd like to engage a conversation, it's very easy for me to go out and get licensed and help you. So let's jump into it. One of the main things for this year is that Medicare has added an income adjustment, or a new bracket, this fifth bracket at the bottom. So the Affordable Care Act, which was passed around 2013, started to have some extra layers of expense to retirees whose income meets certain thresholds. So if a husband and wife are on Medicare and their adjusted gross income is over $170,000, then their Medicare premiums are now means tested. And you can see on the middle column that depending on your adjusted gross income, you will pay more or less for your base Medicare premium. And what's interesting here is that the Medicare premiums, or the income, has a 2-year trailer. So sometimes what I see is a client, say, retiring in 2019, signing up for Medicare, and they think, well, my 2019 income will be $100,000 because I'm no longer working. What happens is the federal government uses your income from 2017 to determine what you pay for 2019. And then into 2020, they look at your 2018 income. So sometimes people can get a rude awakening or a surprise that their Medicare premiums are quite a bit more than what they anticipated because of that income. The nice thing about this, though, is that it does fall off after that 2 years. So if you're making more than $170,000 a year, then in retirement, your income goes below that. The Medicare premium surcharge falls off. And there's also a way to appeal this. So you can kind of speed that process up. And that's also something that we can help clients with. It's a simple form. You get a letter from your employer, you kind of prove your life event, whether you've had a qualifying event like a marriage or a death in the family or something like that, and then you appeal the income adjustment to the Social Security office. So that process is something that I'm happy to help you with. I've walked a number of clients through it as well. So new for 2019 is this bottom bracket. And really what we're seeing are more and more ways that the federal government are trying to capture more revenue to try to help maintain Medicare and keep it financially stable. So this is a updated slide for 2019, and also the income brackets, the 170,000, the 214 to 267. One of the things that's a little frustrating is that those income brackets do not increase with inflation. So those brackets have been stable from year to year. So as you see a cost of living adjustment with Social Security, or maybe start taking a pension, if you fall $1 over those thresholds, then you move up the bracket and you're stuck there. So definitely something to be conscious of, called the Medicare Income Adjustment, or IRMAA, IRMAA. I get tons of questions at this time, and this is a little premature, but I believe you're going to see a cost of living adjustment for your Social Security benefit to increase somewhere around 3%. Whether it's 2.5, 3%. Looks like this year is going to be a pretty positive year overall for people on Medicare, meaning that your cost of living adjustment with Social Security is going to be the highest it's been in 7 or 8 years. And then the Part B premium, which is currently $134 a month, looks like it's going to stay relatively stable as well. And Ryan and I were talking earlier about whether we knew the exact amount, and I don't at this moment, but my best impersonation of a weatherman would be $139 a month. So we'll see how accurate I am here in a couple of weeks. It's also important to note that these income adjustment brackets and the Part B premium surcharge, the $53.50, the $133.90, etc., all of those are percentages of the base income, or the base Medicare Part B. So as that 134 goes up, all of those surcharges increase proportionately as well. The Part B premium is usually announced somewhere around mid-November, so keep your eyes and ears out for that formal announcement. And then the Part B premium for most people on Social Security is just automatically taken out of your Social Security check. If you are not drawing Social Security, then those premiums are billed to you on a quarterly basis. Another change that's been happening, and we talked about this year, and hopefully everyone has heard this, is that Medicare has updated the red, white, and blue Medicare card. For the longest time, it would just use your Social Security number as your identification number, along with a letter at the end, your Social Security number with an A or a B or a D. And in 2018, the government finally updated the Medicare card and was supposed to have all of the new Medicare cards issued at this time. But unfortunately, they hit a couple of stumbling blocks. And to this date, most Missourians, if you have been on Medicare for a few years, you have not received your new Medicare card. So Missouri is actually one of the last states who's getting the new Medicare card. And I believe sometime by April of 2019 is when you will finally get that card. The main thing to realize here is that no one's going to call you, no one's going to charge you a fee to mail it to you. Your new Medicare card is just sent in the mail. You can go to ssa.gov to confirm your mailing address if you've had a recent change in address to make sure that it gets to you. But anybody calling you on this, it's just a scam, ignore it. Your new Medicare card comes, you just start using it along with your Medicare Supplement Plan, or if you're on a Medicare Advantage plan, you just continue to use the private insurance company's card that you have been. So now we jump into my favorite time of the year, the Medicare annual enrollment period. And this is that time of the year where all of your plan options open up. and your current plan your current plan notifies you of any changes for the following year. The biggest thing that I see changing from year to year are the premiums that your Medicare Part D plan charges you, and then the formulary. So a certain blood pressure drug may be a $1 copay in 2018, that may move to $10 or $20 for next year, or they may take that totally off of the list. And that's the main thing that I try to focus on with reviews, is to just kind of minimize those headaches of identifying your current needs, your current prescriptions, and then going to the various insurance companies and making sure that you have the right fit. And it never fails, but every year I get a call in January or February from somebody who didn't review this and says, hey, my new medication or my blood pressure pill is now $60 a month. What can I do? I would like to change my plan. And unfortunately, if you miss that December 7th cutoff, you're out of luck. So you're reactive rather than proactive. In 2019, we've seen a couple of new participants into the Medicare Part D program. Specifically, Mutual of Omaha has added 2 new prescription drug plans in Missouri, as well as surrounding states, and a handful of new Medicare Advantage plans have popped up, specifically a company called Allwell, which is a Centene-owned plan in the St. Louis area. Also new for 2019 is a new low-cost leader called WellCare Value, which is $15 a month across the board. So clients who are not on any medications or premium sensitive on their prescription drug plan, I would encourage you to take a look at this new WellCare Value plan, $15 a month with $0 generics at a CVS pharmacy. All of these changes, mind you, can be found on the Medicare Plan Finder. So this tool is fantastic. It can be used anywhere in the country and starts with a simple zip code search. So if a client comes to me with their current plan, United Healthcare in Florida, for example, this is the tool that I use. I jump on here with them. We go through zip code, we go through doctor, prescription lists, and this tool lets me personalize that option, and then we can look at how their plans have changed from year to year and identify new plans that have entered and capture some of those savings. So Medicare.gov is the official website for Medicare, and that's where this tool sits. So on that website, this is probably the most important slide of everything that we're talking about today. This is that decision tree within Medicare. So cutting through a lot of the clutter, everybody that's listening today has one of 2 decisions they can make. And the left-hand side, I think, is where most of the clients that I work with and most of the people listening right now are probably on. And this is original Medicare along with a Medicare Supplement Plan and a standalone prescription drug plan. So on this side, you show your red, white, and blue Medicare card, the old one or the new one, and then you show your Medicare Supplement card to the doctor. And that's where you get into letters like Plan F and Plan G, which we'll talk about in a little bit. But those plans pay second to Medicare. You pay an extra premium for your supplement, usually between around, say, $150 to $300 a month, depending on the area, the company, your age, which lettered plan, etc. And that plan picks up 100% of the balances left behind by Medicare. So people really like the left-hand side because you can see any doctor in the country you want. There's no network restrictions, there's no referrals, there's no managed care component, which we'll talk about on the right-hand side. And you walk into the doctor and you pay $0, or maybe you have a small deductible. If you go in the hospital, you have 100% coverage. So people really like that comprehensiveness of, if I get sick, the plan performs, I can go where the doctor wants me to go or have whatever tests they're recommending covered, because the insurance company does not manage the care or require any type of prior authorizations. In addition to that supplement, you also have that standalone drug plan. And that's where you can identify which plan you have, either by going to the Medicare website and looking up the different options, or you can just look at your card or the annual notice of change that your plan has sent you, which should identify the current premium in some of the changes from 2018 to 2019. So some of the pros on the left-hand side are the comprehensiveness, allowing you to go to any doctor, any hospital, and the lack of oversight, if you will, by the insurance company. On the right-hand side is the alternative to original Medicare. So rather than supplementing Medicare and paying an extra premium to the insurance company, what you do is you opt into an all-in-one plan. And these plans usually operate like an HMO or a PPO and may mirror what you've had on an employer plan from years past. So for example, in St. Louis, companies that are competitive in our area, Coventry Gold Advantage, United Healthcare through the AARP endorsement, Essence Healthcare, these plans all sign a contract with the federal government, and the federal government subsidizes the private insurance company. So specifically, if a client is on Essence Healthcare, what's been happening is the federal government pays Essence about $12,000 to $13,000 per person per year, and then the federal government steps aside and allows that private insurance company to manage the care or replace original Medicare. So clients on the right-hand side still have Medicare, they still pay the Medicare premium, but they get their 80% coverage through the private insurance company. And the attractive thing for people on Medicare Advantage plans is that those plans typically do not charge extra premiums. So you save the $150 to $300 a month on the Medicare supplement, but the consequence or the negative of Medicare Advantage are a couple of things. One is that those plans could be more expensive if you got sick, because those plans will have copays at the doctor, they'll have hospital fees, they'll have expenses to you for certain services like infusions, chemotherapy, MRIs, and you may find that a Medicare Advantage plan, as you get older or use it more, is actually more expensive than the left-hand side based off of your specific needs in a year. Another negative of Medicare Advantage plans is that those plans manage the care, meaning that the claim doesn't go into the red, white, and blue Medicare, which pays at any doctor, any hospital in the country. The claim comes into the private insurance company. And each individual insurance company has different rules, they have different networks. Using Essence as our example, Essence at this moment does not have the Mercy Hospital or Mercy Providers in network. So if a client was using Mercy and thought, hey, I'll go look at Essence, you're going to have some conflict as far as maintaining access to your preferred doctors. In fairness, a couple of the other Advantage plans I mentioned do have Mercy in network, so we can work around that. But some people don't like the idea of limiting their choice of providers, because if you get sick, you never know where you may want to go. And that's one of the positives on the left-hand side, is that you have access to places like Mayo Clinic or specialty hospitals that may be important in the future depending on the crystal ball. So Medicare Advantage plans can be cheaper because you don't pay the additional premiums, but you give up the ability to go to any doctor in the country that takes Medicare, and you also pay as you go through various copays at the doctor. And most plans in our area, again, there are 21 Advantage plans in St. Louis this year, and our agency sells all 21 of them. So if a client is considering Medicare Advantage, what we would do is identify their doctor preferences, their hospital preferences, their prescription list, and wade through the 21 various plans to help land on the one that's most appropriate. One of the big kickers, though, is if you start with a Medicare Advantage plan, or if you're currently on a Medicare Advantage plan, and now you decide that you'd like to switch back to original Medicare, you have to wait until this time frame, the annual enrollment period, and you have to qualify medically to buy a Medicare Supplement Plan. So what that means is if your health is poor, or you have a pending surgery or a service that maybe your Advantage plan didn't pre-approve, or the doctor you wanted to use was not in network, and you thought, you know what, I'll wait until the end of the year and I'll switch back and go buy a supplement, you would have to disclose your health history, and there's a chance that that Medicare supplement company declines you or rates you up and charges $400 a month rather than the $150 because you have a chronic illness or some sort of pre-existing condition. And after I make that statement, I always get questions of, I thought the Affordable Care Act did away with pre-existing conditions. And in the underage, non-65 market, that's true. But within this context, if you are on a Medicare Advantage plan, or if you leave a Medicare supplement policy and you go to an Advantage plan, and in a few years you decide you want to come back, you're now age rated. So your age at the time you buy the plan determines the rate, and then your medical history determines the availability as well. But for a lot of people, that kind of scares them into, well, if I jump into an Advantage plan now and then I don't like it, or as I get older, ultimately I may need to use healthcare more, I want to get out. I always equate it to the stock market. Is people that I would say the number one call that I get from clients or referrals is people on Medicare Advantage plans that have waited until it's too late. It's a good spot to land, but people can quickly see the limitations of Medicare Advantage at the time maybe they need the care the most. And so they try to come back, but it's after they had that issue or while they're midstream, and then they're kind of stuck on Medicare Advantage. So just a caution is, if you jump into Medicare Advantage, you may find in the future that you're not insurable or able to go back to a Medicare supplement policy in the future. But Medicare Advantage is a very popular option. It certainly has a time and place and is appropriate for a lot of people. And one of the things that I would do on a meeting or a consultation is to just explain the pros and cons. And as long as you understand the sacrifices or the limitations of an Advantage plan, it can work really well as long as you follow the rules of the plan. So outside of the annual enrollment period, which is October 15th through December 7th, the only time you can switch paths is if you have a qualifying event. And one of the most common events would be if you come off of employer coverage. So somebody that is like Ryan's parents who were in the education system, if they retired mid-year in July, they would have this opportunity to leave that retiree plan and transition onto one of these paths in July. They wouldn't have to wait till the end of the year. So that's a really common special enrollment period. And another one is if you move. If you move out of the service area of your Advantage plan, for example, Essence outside of St. Louis really doesn't exist. So if you move to Florida permanently, you would be disenrolled from your Advantage plan here locally in St. Louis and have an opportunity to go buy a plan based off of where you're living at that time. And that would be available to you mid-year. I always tell clients, if you can feel like you understand the pros and cons between the two different paths and either acknowledge that a supplement is a higher premium but more comprehensive, or a Medicare Advantage plan exists the way it exists because it's getting compensated by the federal government. If you can feel like you understand the pros and cons a little bit between these two paths, you are ahead of probably 95% of the people on Medicare. And this slide is great because if we look at somebody in Illinois, we look at somebody in Florida, we look at somebody in St. Louis, through the Medicare Plan Finder, I can quickly identify all of the available plans on both sides of the path, specific to the zip code or the county that you live in. So pretty much everybody on Medicare is either on the left-hand side, and then you get into the weeds as far as like Plan F and Plan G, or that $15 drug plan I made reference to earlier, or they're on the right-hand side and they don't show their red, white, and blue Medicare card. They show their United Healthcare PPO card or their Coventry HMO card, and that plan dictates care, and the claims come into the private insurance company, not the red, white, and blue Medicare. And it is very common for people to, I would say, incorrectly label their Medicare Advantage plan as a Medicare supplement policy, because technically this is not an apples to apples comparison. There are specific pros and cons to both sides. Another hot topic this year is the prescription drug benefit within Medicare. So for the longest time, your Medicare Part D plan, whether it was integrated and built into an Advantage plan or on a standalone basis, had this very cumbersome coverage called the donut hole or coverage gap. And what has been happening over time is that the donut hole has been shrinking and slowly phasing out. A person only hits the donut hole if the negotiated price of their medications exceeds approximately $4,000 in a calendar year. So if the negotiated price of your drugs don't exceed that threshold, then you've probably never experienced this. But if they do, then you would, when Part D first came out in 2006, have to pay 100% of the negotiated price. So that $500 drug could go from a $50 copay to you pay $500. And then slowly but surely the donut hole has closed. So it's gone from 100% to 50% to 40%, as you can see on the slides here. Well, there's this misconception that the donut hole is going to totally phase out and be eliminated in 2020. And while the donut hole is being closed, it still has the opportunity to bite somebody if their drug costs exceed $4,000. So what happened in 2018 is there was this law called the Bipartisan Budget Act of 2018 that sped up the closing of the donut hole. So specifically what it did is it moved the 2019 row and bumped up the 2020 coverage level a year faster. So you went from, instead of paying 30% in the donut hole in 2019, you'll now pay 25%. But at this moment, if a person crosses that threshold, they are still responsible for 25% of the negotiated price of their medications. I find the most common reason people fall into the donut hole are insulin, breathing medications, and these new blockbuster heart medications like Xarelto, Pradaxa, Eliquis. I find that those get you into the donut hole because they're expensive. Most insulin, whether it's a flex pen or a vial of insulin, the negotiated price of almost all insulins is close to $500 a month. Same thing with Advair and Brio and some of these breathing medications that people take on a daily basis, as well as a heart medication. So when you hit the donut hole, you're still responsible for 25% of the negotiated price. You don't have a copay per se, you pay a percentage of the cost of the medication. So that is a pretty big misconception, is people think that, oh, the donut hole is going to go away, I don't have to worry about it anymore. At this exact moment, it still exists, albeit at a much less expense to you, but it still has the potential to be felt by certain clients. The Medicare.gov website also simplifies, if that's the right word, the donut hole, because it gives you the negotiated price of your prescriptions, and it also tells you when you would enter the donut hole and what your copay would be as well. Another thing that is new in the Medicare, really the healthcare space, is a new amendment that unfortunately was not passed, but I thought this was a great idea. There was an amendment that would require pharmaceutical companies to disclose the cost of their medications right on the TV commercial or on the print ad in a magazine. And a question I had for people is, would knowing the actual negotiated price of a medication up front deter you from taking them? And I kind of thought about this and I thought, I don't think it would. But then I think back to the very first time that I saw calories listed on a menu at a restaurant. And that changed my behavior. I was in Washington, D.C., it was 10 years ago, and I still remember seeing the calories next to what I was going to order, and I ordered something different. So it changed my behavior. Whether I do that every time is debatable, but I just have that memory. And I think knowing the actual cost, the cost of these prescriptions would go a long way to to changing people's behaviors. So of course, the pharmaceutical company was not in favor of this amendment and magically swept it under the rug. But while it was gaining traction, there was an interesting article in the STL Today, or the Post-Dispatch, that showed some of the most commonly advertised medications in the Medicare negotiated price. So everybody's probably heard of these prescriptions before. Keytruda is a medication used to treat certain types of cancer. Humira is actually the number one, by revenue, the number one prescription drug in the world. And a monthly cost of Humira, which is a twice monthly injection, is almost $6,000 a month. So a person would get into the donut hole relatively quickly with that type of medication and still be responsible for 25% of the cost, but then they would move into the catastrophic stage, which would help alleviate some of that. Trulicity is a diabetic medication, and Eliquis is one of those blockbuster heart medications. Conveniently, the branded competitors of drugs like Eliquis and Trulicity, Xarelto, Toujeo, these are drugs, again, that are advertised, are literally the exact same negotiated price. So there's really no incentive for these manufacturers to drop the price of medication because the insurance companies are subsidizing or picking up a big chunk of it, and it just helps keep costs inflated. So these medications are some of the more popular ones. There's a couple of lists out there that show the top 10 or 20 medications by revenue or monthly or annual advertising from 2017. I just thought this was a great wake-up call or something that would be in your face that would maybe change people's behaviors, but unfortunately it did not pass. So jumping on to Medicare Supplement Plans. So this is on the, if we go back to our slide, on the left-hand side of the equation, if you have a Medicare Supplement Plan, this is a card that you show second to Medicare, whether it's through Blue Cross and Blue Shield of Texas or AARP or Transamerica, all of these carriers by law have to offer a standardized policy. And I find that most people have either Plan F, Plan G, or Plan N. But there's an opportunity, if you're paying $300 a month for your supplement and you are happy with it because it pays everything, but maybe getting a little frustrated with the premiums going up, then that's something that I could absolutely help you with, because Medicare supplement plans are standardized policies by law. Meaning, if you have Plan F with carrier XYZ, Plan F with carrier A is the exact same coverage, but oftentimes at a much lower price. Or maybe looking at a different lettered plan, which still offers the same comprehensiveness, maybe just a slightly different structure. Maybe you pay a small copay at the doctor, or you pay your first deductible with Medicare, which is about $200 on Plan G. And that can save $1,000 or $2,000 a year. I find often that's the low-hanging fruit, is we're not changing paths. So you're staying on the same side, you're keeping things as close to apples as you can, but you're just capturing that savings by going with a company that's more rate competitive. In 2020, Medicare supplement plans are kind of undergoing a facelift, and specifically Plan F is going to be grandfathered in. And this is something we've talked about last year and has made more mainstream news lately. So I would assume most people have heard of this, that Plan F is going away or is being grandfathered in. Specifically, what's happening is you can keep Plan F forever because these benefits can never change on you. But a concern is that as Plan F moves to the side, newer people aging into Medicare, younger people, those healthier people who are more price sensitive are switching to Plan G and Plan N. They're leaving Plan F, which leaves a older risk pool, a higher average age within that Plan F group, which can cause the rates to get out of line faster. And a simple example would be If we had 180-year-olds on Plan F and 165-year-olds on Plan G, on average, you would assume that the group with the 65-year-olds would have less claims and therefore less rate adjustments than that group of 80-year-olds. So that concept is what's moving a lot of people off of Plan F and onto some of these other lettered plans to capture some of that savings. So the only difference between Plan F and Plan G is that annual deductible. And I find oftentimes if you pay your Part B deductible, which is this year $183, if I had to make an educated guess for next year, probably right around the same amount. Maybe it's going to go up $10 or $12. By paying that deductible out of pocket rather than having the insurance company cover it, I've found consistently anywhere between $500, $2,000, up to maybe $2,000 a year in annual savings by switching somebody from Plan F to Plan G. If you're listening and you're a Missouri resident, Missouri has a unique law that lets you switch on your policy anniversary date without answering health questions. So that would be something that I could help you with or explain further as well. A couple of other states have similar type laws, whether it's a birthday law or on a specific date where you can switch from one Medicare supplement plan to another without answering health questions. And remember, this is not switching paths, so if you're on an HMO and you come over to a supplement, you would still be required to answer health questions, but rather this is staying on the same path, the left-hand side of that column, and switching from one Medicare supplement plan to another. So clients I work with, we try to review this and make sure that you're not leaving money on the table as far as staying with the same supplement for too long. The big thing here is that Medicare supplement plans are all standardized. So the benefits and the availability and acceptance at doctors is all the same. Here's some sample rates for, I would say, a couple of the companies that are most competitive in our area. So if you go and check your bank draft or your online bank and you see you're paying substantially more than this for a Medicare supplement plan, I'd be happy to give you a free quote or maybe dig a little deeper to see if there's a reason to switch or capture some of those savings. So I think the theme of this year is 2019 is going to be a pretty calm year. I don't see massive increases for Medicare supplement companies. I don't see a big increase on the Medicare Part B premium. And with some of the new players into the Medicare Part D world, I see a lot of opportunity to keep your premiums relatively the same. It might take a little effort to look at what you're paying and make sure that your plan is not getting out of line, but I think the overall theme of 2019 is that people on Medicare are going to have a pretty calm movement from 18 to 19 without a lot of disruption. Especially if you are on one of the more popular plans like WellCare or United Healthcare or Humana that have had a low premium for a few years. I think you'll be pleasantly surprised when you review it, or if you look at your annual notice of change, that your premiums aren't jumping too high. And then on a Medicare Advantage plan, I would encourage you to look at that annual notice of change and just acknowledge or see what your potential costs would be if you went in the hospital, if you had a major surgery, because most of the Advantage plans in our area have maximum out-of-pockets around $3,000 to $6,000 per person per year. So if you did get sick, that would be your responsibility, but just being conscious of that up front avoids some of the sticker shock when those bills come. If you'd like a free review, I'd be happy to take a look at your stuff. My contact info is on one of the last slides, and we'd be happy to just work with you in the future.
Thank you, Karl. Great information as always. You've done a great job of helping make us just a little bit smarter about something that really is a complex and complicated issue. And if anything, I think you've reinforced the idea that there's really just no reason to go it alone when it comes to something like this. It is complicated, it is complex, And there's real dollars involved. I mean, geez, just some of the cost figures you showed us for some of these medications and all the different options that you have and the different price points of all of them, it really does pay to try to help.
I think I've known you guys for 6 or 7. It's been a while, and one of the first clients you sent me, I think I had reviewed their stuff, and they hadn't looked at it in 10 years, and they saved close to $3,000 annually just by reviewing their Part D plan.
Especially since, as you mentioned, you're kind of already paying for it anyway, so you might as well have someone on your side to help you make these tough decisions. We did get some questions to come through. We'd like to take a couple of minutes to address some of those. We still have a little bit of time. If some of you would like to enter in questions, use that Q&A link and we'll try to get those addressed. The first question that we have here is, if you're satisfied with your current Medicare solution, do you need to re-enroll every year, or does that kind of happen automatically?
It's a passive enrollment. So if you're happy with your current plan, just keep your head in the sand and keep cruising along. And that's contrary to all this marketing buzz and, the direct mail and the TV ads and people at the grocery store. You get this anxiety of like, well, I must be missing something, right? I have to do something or I'm going to be left behind. And I think that's just the goal of marketing, right, is to get you to act. But if you're happy with your plan, as long as your plan is not terminating on you, which is a different situation, you can just keep cruising along and there's no action needed to re-enroll into the same plan for next year.
I like that answer.
Yeah.
How often should a person review their coverage, or how often typically do clients come in to meet with you? Every year, every 5 years, probably not every 10 years like the other example you shared.
Our process is, in early September, we send an email and a letter out to clients asking for them to send a prescription drug list in. And then we have staff and myself will review your drug list proactively at no cost to you, just to have a set of eyeballs on it. And I mean, the worst that you're going to get is you're going to get an email from me at 1 a.m. saying, hey, I checked it out. You're in a good spot. No action needed. You looked at it. The best you're going to get is you're going to get an email that says, hey, I think there's $1,000 sitting here by switching you from Aetna to Coventry or from United to SilverScript. I would change if I were you. And where our agency is so uniquely positioned, for clients that I've worked with for a number of years, as an insurance broker, I get paid the exact same amount if I sell somebody a Medicare plan and they never change it, as if I switch them every single year. So as a broker, I have zero incentive to switch you every year because I get paid the exact same. In fact, you could argue I have an incentive to not do anything because then I don't have to stay up late reviewing all this stuff and doing the work. But I find we have grown tremendously through that process of, mom and dad come to me, we review it, and you go play golf with your friends and you kind of say, hey, I got a guy that just looked at it and he saved me $1,000. Well, then the 3 golf friends call me on Monday and 2 of them I can help, something like that. So we review it every year. I mean, I don't know if there's a black and white time frame. If you have a life event, sure, if you start taking new medications, but that's where you have to be a little careful because then it might be too late to make a move, right? If you're on an Advantage plan and now it's not working for you, it's usually because you've gotten sick or just some change, which might mean it's tough to jump back onto a supplement.
Certainly, you also mentioned earlier in the presentation that if somebody moves to a different state, just because that can vary so much state to state, it's another good opportunity to go in and kind of relook at everything too. So
if a person moves their Medicare drug plan or their Medicare Advantage plan, technically will terminate on them automatically because Medicare Part D is state specific and Medicare Advantage is county specific. So if you moved and you called your Medicare Advantage or Medicare Part D plan, they would either re-enroll you right at that time to their Florida-based or Nebraska-based plan, and it might change a little bit or a lot, but that is a qualifying event to go switch from company A to B because that other carrier may be way more competitive in that state.
So we've got another question here about the premium surcharge for having income that's over one of those thresholds. The question is, does all that sort of happen automatically?
Yep.
And I guess if that all happens automatically, that's some way related to the appeals process, which I'm guessing there's nothing automatic about that.
Correct. So I always tell people the Medicare surcharge, the IRMAA, IRMAA, it doesn't matter how well or poorly I explain it, it is confusing. Because oftentimes you're coming into this for the first time, or you had that, one-time event of an inheritance, or you sold stock to, bump your income up 2 years ago, so you forgot about that, and now your income is catching up to you. But the government will send you your Medicare premium and then send you a notice that says, hey, 60 days later, here's this extra fee because we went and looked at the IRS database. If a person is drawing Social Security, then all of that income adjustment is just swept out of their Social Security check automatically. If they're not drawing Social, that's where that confusion really is magnified, because you get all these, a quarterly bill here, a 1 month bill here, a quarterly bill over here. Then you are responsible for writing the checks out for those quarterly premiums. And the appeal process is absolutely something that takes effort on your end. They're not going to automatically appeal it for you.
So basically, if everything's right and your income's changing, all that's going to be communicated through tax returns, IRS, all that is coordinated. An individual doesn't really need to do anything unless they feel there's a reason to appeal the premium that they've been asked, again, for one of those reasons that you described, such as retirement or whatever.
Yep.
So, okay.
In the appeal, it has no cost to it. Like, I don't charge anything to help people. It's a document plus kind of your evidence, so to speak. What was your life event? Well, I stopped working. Letter from your employer. I know we've worked together with like investment gains to try to show, hey, in retirement, I'm on Social Security is $40,000. I'm taking a draw, and that's $60,000. I'm going to be at $100,000 of income. Don't use 2 years ago that showed me at $250,000. Here's my evidence, and then here's the appeal form, which is just like a 2 or 3 page document.
And that appeal process, is it pretty straightforward? Meaning that, yeah, if you've got a valid reason, they're going to accept that. It's not
call it a 50-50 shot.
A 50-50.
Yeah.
For the government, that's pretty good.
And you think of a husband and wife at $250,000 over the course of 2 years. I'm ballparking this, but that's like 15 or 18 grand of additional premium. So, and it's worth an hour or two at a time, and then just go to the Social Security office and turn it in. And the worst they say is no.
Right. There's no reason not to.
Yeah, and unless it's just a glare. If you're making 500 grand every single year, no matter what, then you don't have any evidence, right? But if you have one of the valid life changes, and I find a work stoppage is usually the most common one, right? You're 68, you've been working, now you're not. You can kind of connect the dots pretty easily. So
another question somewhat along those same lines. So is that income based upon earned income versus deferred income? Where you show Social Security the documentation on deferred income, would that require a separate appeal to Medicare?
It would all be the same, and the exact income that the government uses is modified adjusted gross income, which starts to get out of my comfort zone and area of expertise. But as I've had this conversation more and more, I believe it's basically all sources of income.
That's right. So anything that shows up under your adjusted gross income on the front page of your 1040 that you file federally is going to be the starting point for that calculation. And because the IRS loves to do stuff like this, the actual way you calculate that modified adjusted gross income is different depending on the reason that you're calculating it for. So believe it or not, the same term can actually have different calculations and different outcomes associated with them depending on what it is you're looking at. In the case of Medicare premiums specifically, they base that on your adjusted gross income, and then they just add back in any tax-exempt income. So if you own municipal bonds and they paid you tax-exempt interest, that would then be added to that adjusted gross income number to give us that modified adjusted gross income that they would then use to calculate that income adjustment on it. So anything, to answer that question, anything that does show up on the front page of that 1040 that winds up in adjusted gross income, it's going to be there and communicated.
I usually suggest that you send, the best thing you can do in theory is, like, let's pretend that somebody retires on 1/1/19, or maybe they retired like mid-year in 2018. and then they had COBRA, or if you can show on that 1040 form, the front page, that, circle the wages that came from your employer, and if you can kind of let the math speak for itself of you're taking 200 grand out of there, then that really, now you're at 80% success rate instead of 50-50.
So switching gears just a little bit, one of the things that people seem to be more and more anxious about, and for good reason, is this concept of identity theft. And I've kind of heard in numerous channels that the theft of medical and health insurance related information is really getting to be pretty problematic. You just shared before that the new Medicare cards are going to have a unique number instead of a Social Security number associated with them. At this point, are you aware of any additional steps that Medicare agency is taking to try to protect information of those people that are enrolled?
On a consumer level, from like the street level, not really. We're seeing a lot more like data mining with the government going in and auditing physicians. And going back, I know there was like a really prominent case a year or two ago with ophthalmology procedures, and the government just went in and they looked at the 5,000 or 10,000 ophthalmologists all over the country, and they saw those 5 or 10 outliers that they were billing, 1,000% more number of procedures, revenue, and so that was just a red flag. Let's go look at that. And then they found obvious fraud. So we're seeing more on the physician level, or maybe just kind of the behind the scenes level. The answer you're going to get with Medicare is that as a beneficiary, you should be opening your Medicare summary notices, those quarterly statements that kind of are Greek even to me. I've looked at a bunch of them and I scratch my head on them too. So, but looking through there and going, wait a second, I didn't see this doctor. Who is this? And then maybe snooping a little more. And if you find that somebody has stolen your identity and you have claims that are not accurate, you should be calling 1-800-Medicare to make them aware of it.
At this point, I think we're going to go ahead and wrap up. Again, thanks for joining us today, spending the time. Your information's invaluable, and you really know your
Good
stuff.
to see you again.
Thank you, all of you out there watching live and on replay. Again, we hope you find this has been a very useful use of your time. And if you have any questions that you didn't get a chance to ask today, or if you're on replay and you have questions, Karl's contact information is right there. It'll be coming in the follow-up. Please feel free to give him an email, give him a call, set up an appointment to go meet with him. Don't ask me, because all I'm going to tell you is call Karl. That's what I tell everyone when they ask me questions like this. It's complicated. Call Karl. So again, thank you very much for your time today, and have a good one.
See ya.